Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
The groundwork for all happiness is good health. Very good evening, viewers. Welcome to today's episode of BMC Global Live Al Hilal Health World, an exclusive health talk with doctors from Al Hilal Hospital and Medical Center. This is Mareena Francis, your host for today. In today's episode of Health World, we will be taking up the topic UTI, that is Urinary Tract Infection. We will be speaking about how to manage UTI and most importantly how to prevent UTI. Definitely being the summer time in this part of the world, I think it is an important topic to talk about. And it is my pleasure to welcome the doctor joining with us today, Dr. Shabeena Naz. She is a female urologist currently working at Al Hilal Hospital, Mohrak branch. Good evening, doctor. Welcome to Al Hilal Health World. Thank you for joining with us today.
Thank you so much for inviting me.
Yes, doctor. So before we go on specifically to UTI, let me ask, what are the common urological diseases?
There are a lot of the urological diseases, but the most common is urinary tract infection, as you know.
Yes.
And along with this, the stone disease, the urine voiding problems, urine storing problem, prostate and malignancies. And this part of the world, the climate is hot, the water is heavy, so the patient are having more stone diseases and more UTI.
Yes. Okay. So definitely today we have an important topic to discuss about UTI.
Yes.
So what is actually UTI?
UTI actually is the infection or invasion of the urothelium, you can say the epithelium of urinary tract. And what is the urinary tract? Urinary tract includes the kidneys, ureter, bladder and urethra. An infection of the urinary tract by the bacteria is known as a urinary tract infection, UTI as in short. And for the UTI, the symptoms the patient got, it's because of the inflammatory reaction of the epithelium of the urinary tract. That's the patient got these kind of symptoms.
Doctor, so UTI, how is it common for males or females more? How is it different for males and females?
Actually, the female are having a short urethra like 2 to 3 centimeter and male having long urethra. So the prevalence of the UTI, urinary tract infection, is more common in females. Like you can say it's 50%, 50% in females as compared to males. That's why female gets the infection more frequently than that of the male. And also the females having one episode in per year can have one episode per year, and they will get the chance to get another UTI in next 6 months. It can be recurrent or reinfection, this kind of infection. And the UTI in female is a simple one. And before going into telling you like the UTI or what kind of UTI female can have, we have two kinds of UTI. These are simple or uncomplicated and complicated UTI. In fact, the uncomplicated UTI is occurring in non-pregnant, premenstrual women, and they are simple to treat. And for the male, or the patient having diabetes, or patient having immunocompromise, or patient having any other risk factors, having any infected stones or obstructive system, they will get the complicated UTI. So the UTI for the female and male are differing in such way. In the female, if she is not pregnant, if she is not a menopausal woman, her infection will be simple one, means uncomplicated. And for the male, if he is having infection, it would be complicated, and it have for the treatment, simple UTI can be treated for short course of antibiotic, and for the complicated one, we have to take the longer duration of the treatment. That's why.
So doctor, you spoke about males and females. Are UTI also found in children as well?
Yes. In the children less than 1 year infants, UTI are more common in males, 3% as compared to 1% in female. But in school going age, UTI are more common in female. And as you can say, from the start, from the childhood, the UTI are more common in female as compared to male one. But the pediatric urology, pediatric urinary tract infection is a totally different and vast entity. It can be spoken on another time.
Yes. Okay. So doctor, next question would be, how can we know that a person is suffering from UTI? What are the symptoms they show, and how is it diagnosed?
For the diagnosis purpose, it starts with when the patient comes in your OPD. Patient present to you with dysuria, which is burning micturition, it's urgency. Okay. Sometimes it's difficulty in passing urine, sometimes it's offensive smell, okay. Sometimes it's hematuria and fever. But the patient coming to you with the hematuria and fever, it's you can say it's a red flag sign in UTI, but it's maybe complicated or somehow, but it's a rare one. And then we sometimes patient present with a suprapubic pain, and we examine the patient for the general physical examination, for the temperature, for suprapubic tenderness, and in the case of female, we examine her per vaginally and per urethral, any cyst, any UV prolapse, you can say. And then we go for the investigation. Okay. For the investigation, the simplest and the one and only for the first time presentation is urine routine analysis. In this we check the urine with the dipstick and microscopy. And we check for the WBC count, we check for the bacteria, we check for the pH level, we check for any crystals and all these things. And we don't go for other investigation when it's female, non-pregnant, menopausal women. But we go for the other investigation only when the patient is pregnant, patient present with the recurrent UTI, our patient is having stone disease, our patient is male. The other investigation we go for our ultrasound, CT. It depends how we can proceed with the investigation. Okay. Yes.
So doctor, in that case, who would be at more risk of getting UTI?
The reason getting more UTI are because of some risk factor. As you know, I already told you, the female gender is at risk.
Yes.
Increasing age at risk. As the elderly male, in the elderly male, there is a prostate issue because prostate gets enlarged and it causes infection. And in female, decrease estrogen level leads to infection. If the patient is pregnant, if the patient is diabetic, if the patient immunocompromised, taking any medicines for long time, and in the nursing home, the old elderly male and female getting UTI because of not good handling, because of poor hygiene. Yes. And if the patient is having catheter for the long time, if the patient is having underlying stone disease, if patient having any structural abnormalities and all these patient can have UTI.
Okay.
Yeah.
So definitely we only spoke about the basics, technical aspects of what is UTI and who are at risk of getting UTI. We need to know how to manage it and how to prevent it. But we will be back after a very short break.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Welcome back. You're watching BMC Global Live Al Hilal Health World. Nothing but lifestyle. In today's episode, we are discussing about the topic UTI, that is urinary tract infections. So let's move ahead with further queries. Doctor, so we spoke about who are at more risk of getting UTI. Yes. And what are the symptoms shown, the causes. Doctor, once UTI is diagnosed, how do we manage it or how is the treatment done?
For the treatment purpose, the basic aim of the treatment is to eliminate the bacterial growth from the urinary tract. And once patient is diagnosed with the UTI, we treat him or her empirically at first, according to the symptoms, until we get the CS report. CS report is, you can say, urine culture and sensitivity report. We sent at the first, when the patient come with us with the sign and symptoms of a UTI, we send the urine culture for culture and sensitivity. It takes 2 or 3 days. That's why we start the patient on empirical therapy, empirical antibiotics according to the sign and symptoms of the patient until the report comes. And definitive treatment is according to the culture and sensitivity. We use the antibiotics according to the culture and sensitivity. And then the definitive management is treat the underlying cause. If it's any malformation, any obstruction, if there is any stone, you have to address that problem so you can be able to treat the UTI.
Okay, so apart from medicines, the person might need to get admitted to the hospital also at times, maybe.
Because UTI is very simple to treat, very simple to diagnose, but it can lead to many other complication. If it's because of a stone or underlying obstruction, it can lead to renal failure. It can lead to urosepsis. You can say a patient has to be managed in ICU. But these things are with the immunocompromised diabetic patient or patient having any other immunodeficiency like HIV or all these kind of things. Are in using corticosteroids or chemotherapies, these patients can get this type of UTI, but it can occur. Yes.
So, doctor, how serious or how important it is to visit a doctor when we feel that suppose we are having UTI?
It's very necessary to visit a doctor when you get these symptoms. I know a lot of the patient read on the internet, they know all the information about UTI, but the treatment is according to their sign and symptom on the net too. But the patient asks them question, asks them regarding stone history, investigate them, and they come to know about what kind of UTI they have. So they treat them accordingly. So it's very necessary to visit your doctor when you get these symptoms, because it may lead to recurrence and all these things.
Okay. So doctor, talking about that, can a person get UTI again and again? Can it be recurring?
Yes, UTI can be recur. I already told you before, if a female is getting UTI in a while, a female young female, 20 to 50 years, she can get UTI once in a while. When she gets the UTI, there are 15 to 20% of the chances to recur, and in next 6 months. If you don't treat the UTI properly, means not according to the guidelines, not according to the culture and sensitivity, your UTI can recur. And for this purpose, you have to go to doctor, because he or she will give you the medicine according to your sign and symptoms, and then to the culture and sensitivity, and you will get better. But if you treat yourself at home, you will take antibiotic 2 or 3 days and then left it, and it won't get properly treated, and you will get recurrence. And then you will rush to the doctor, because I get the UTI again, what's the problem, what's the reason behind, and you become anxious and all this. You have to be very careful according to these things.
Doctor, so you spoke about how it can be treated, how UTI can be treated, but I think the most important question here would be how we can prevent from getting a UTI.
UTI prevention is more important, and for the female point of view, because females female having short urethra, and they are more prone to get the UTI. That's therefore it's very important to prevent UTI, because I told you, if once occur, it can recur, it can lead to the other complication and all these things. For the prevention purpose, you have to take adequate amount of fluid. Research is limited, but it does work. And another important thing is avoidance of the spermicides with the contraceptives, because it increases the susceptibility of the organisms or adhesions of the bacteria. And when the adhesion of the bacteria increases, it leads to infection. You have to avoid bubble baths and perfume soaps, because they kills the protective organism living in your tract. You do have protective organism who prevent you from the UTI. If you use bubble bath, douches, is streaming with the water, they will kill your protective organism and will increase the chance of infection. And very important for the mothers, for the young females, please always wash yourself from front to back, not from back to front, because when you wash yourself from back to front, fecal contamination occurs to front your vagina, your urethra. It will lead to the infection. And for if you have a female kid, you have to wash her from front to back and teach her how to wash yourself. And another very important thing for the married female, please always void before and after intimation, because if you don't void, it can also lead to infections.
Okay.
That's all. But you have to prevent yourself from the UTI, because if you get it, it will recur.
Yes. Doctor, you being a female urologist, we understand that females prefer to visit a female urologist. Can you speak about the availability of female urologists in Bahrain and commonly?
As for the female urologists, they are very rare outside the world, mostly in Middle East and Asia. And part of this field, it's good to be a female urologist, because a female patient always hesitate to go to a male urologist because of privacy issue. When you go to them for UTI, for any other problem, they have to examine, because doctor examined you. Okay, they have to examine you, and females hesitate to be touched by the male doctor. That's why it's good to have a female urologist in the system, so the female can be easy to go to the doctor for their checkup, for their treatment, because doctor checks you per vaginally for the examination purpose. If you having UTI, you having stone disease, and as for the treatment purpose of the stone disease, we have the recent technology regarding recent procedure endoscopically. They have to go from the urethra, female urethra and male urethra, to in the female we have to go from the urethra and to the bladder to upward. And it's also very inconvenient for the female patient to just heard about you have to go through our urethra and the male doctor. So it's good to have a female urologist in the system. Patient can come and discuss their problem with us, and they can get treated, and they can get better.
Sure. So definitely it's a huge advantage that you're available in Al Hilal Hospital. Doctor, can you talk about your timings and how you are available?
Dr. Shabeena, female urologist, available in Al Hilal Hospital, Muharrar, every day 9 to 1 p.m. and from 5:30 to 9:30 p.m. Except Wednesday.
So doctor, coming towards the end of today's episode, can you sum up about UTI as a takeaway message for our viewers?
As a takeaway message, it's very, very easy to prevent UTI, but if you get one, please do visit your doctor and to get properly checked and properly treated, so you can be prevented.
Sure. Thank you very much, doctor, for joining with us today and answering to all our queries. It was nice meeting you, doctor.
Thank you so much. Thank you so much.
Definitely, I hope that viewers found this episode quite relevant and informative. We will be back again next Tuesday, same time, 8 p.m. Until then, this is Mareena Francis signing off. Stay happy, stay healthy. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.